her cabinet offices, both at 3:30 and on Saturday if required. And with that, I'll introduce Dr. Henry to provide an update.
Thank you. So we have an additional 7 new cases today to bring our total in British Columbia to 46 people who have been diagnosed with COVID-19. To start off with, I'll give you a bit of an update on the Lynn Valley Care Centre outbreak. We have 2 additional healthcare workers from the Lynn Valley Care Centre who have tested positive. They're a male in his 20s who lives in the Vancouver Coastal Health Region, and a woman in her 50s who's in the Fraser Health Region, and both of them are recovering in isolation at home. And the respective health authorities are doing their investigations to determine if there's any additional close contacts. Other than that, things have settled and are still being monitored very closely at the care centre, and in particular residents are being monitored every day, as are the healthcare workers. We have a number of returning travelers who have tested positive today, and 3 of them have travel that's related to Egypt right now. So one is a Vancouver Coastal Health a man in his 70s, and he's related to the traveler from Egypt that we reported yesterday. And an additional, for the first case it's a presumptive so far, but we expect it will be confirmed at the BC CDC. There's a man in his 60s who also was on the same traveling group in Egypt, who's here on Island Health. Additionally, there's a person who lives in Egypt, a man in his 70s, who is visiting here, visiting family in Fraser Health, as tested positive. So there's a number of family members who are also in isolation. He's in isolation at home and being cared for, and the family and the close contacts are all in isolation and being monitored by Fraser Health. So finally, we have 2 additional cases that have just arose today from our surveillance that we're doing around respiratory diseases. So from influenza testing, that's automatically. COVID testing is done, and so those are our 2 new community cases. They're both in the Fraser Health region. One is a woman in her 60s, and unfortunately she's at the moment in hospital, although in stable condition. And the other is a man in his 60s who's in isolation at home. And as you can imagine, as we've discussed before, detailed public health investigation is being done on both of those cases, as well as the 2 that we had yesterday, to try and determine the origin of their infection. On the positive side, we talked about yesterday, there was a man in his 90s who had been admitted to hospital, and he has improved and is now discharged from hospital and at home. There was a woman in her 60s who had been on the Grand Princess, the cruise from the 11th to the 21st of February, and she also has been discharged home. So that's really good news. We also reported yesterday that our case 21, our first community case, is the healthcare worker who works at the Lynn Valley Care Centre, had been admitted to hospital a few days ago, and she also has been discharged home. So that's positive news for all of those people and their families. So really, today there's been a couple of events that have happened. One is, of course, the declaration of a pandemic, and I'll talk about that in a minute. One of the things that has become apparent to us is how fragile our long-term care system is, and how we need to be doing more to enhance our prevention of people in long-term care and our assisted living facilities. Given what we have talked about before, what we know about this virus and how it can affect our elders and seniors in our community, and how it can be devastating in that case. We've had some really great stories of older people who've been infected, who've done well, and I think that's really great, and it reflects the fact that we have a health care system that's been able to provide the care they need, and we need to do everything we can to ensure that that continues as this progresses around the world and here in British Columbia. So part of our efforts to contain this spread will be implementing measures in all of our long-term care homes, and things like enhanced screening of visitors who are coming in, I won't say stopping of visitors, but restriction of visitors, making sure that nobody comes in that has any respiratory infection, making sure that we don't do things like have group sessions where people are interacting with multiple people. So you go and you visit your own family member. You make sure that you take all the precautions that we know are important at preventing transmission of infection, like cleaning our hands and really, really particularly staying away if you're ill. We'll also be looking at enhanced screening of healthcare workers as they go to work to make sure that they are checking themselves, monitoring for any symptoms they might have. So these are all things that we do on a regular basis during influenza season, but we need to make sure that everybody is aware of it, and we step that up right now with the issues that we know are going on in our communities and with the fact that we do already have an outbreak in a long-term care home. We have a stakeholder working group that's involved with all of the long-term care homes and assisted living committee leadership, and we'll be communicating with them in the next days about how that will look and how we can support them in the system to make sure they have the tools that they need to be able to do this in the best possible way. We are also looking at, so the pandemic declaration is something that's important. It's something that we've been talking about for several weeks. We have watched this virus increase and cause outbreaks and sometimes severe community outbreaks around the world. And I think we've learned a lot from the countries that have been dealing with this ahead of us. We know, if nothing else, the measures that were put in place in China have bought us the time to understand more about this virus than we would have several weeks ago. And what we do know is that it's not inevitable that everybody is going to be infected with this, that it's not inevitable that our systems are going to be overwhelmed. We do not have to be in that position. And I know that we can take actions now, and we will be taking actions now to do everything we can to continue to contain, to stop those chains of transmission, to manage every outbreak as it arises and as we detect it, and to do everything we can to draw this out, to delay, and to ensure that we have a health system that's able to care for people who have COVID-19, but also care for the rest of the people in our communities that need the care and the health care that in our system. So we are, and we must all, at this time, step up our social distancing. This is not forever. This is for the coming weeks. The coming weeks where we know we have to do everything we can to prevent transmission of infection in our communities, to protect those people who are more likely to have severe illness, and particularly our seniors and elders. So right now, I'm asking everybody to take those measures, to increase your distance between people, to look at gatherings where you can stay apart from others, to clean your hands regularly, to cover your mouth when you cough, to stay away from others, even if you have the sniffles right now, to stay away from others and prevent the transmission of infection. And these are the things that we can do in our communities and our families to keep us safe through this time.
Thank you very much, Dr. Henry. It's, as Dr. Henry has noted, that's 7 new cases today. That's 46 across British Columbia. In terms of health regions, that's represents 22 in Vancouver Coastal Health, 22 in Fraser Health, 1 in Interior Health, and now 1 in Island Health, noting that 4 of those in Vancouver Coastal Health have had their cases resolved with 2 consecutive negative tests. Just to put in context what we've seen, that 5 have been related to cases to travel to China, 16 to Iran, 1 is the trip you know of from Hong Kong and India, 1 from Washington State, and then a number from Egypt and other places. I think that what Dr. Henry has said today on the good news side is that this continues to be a very significant challenge here in British Columbia, a major one, and the declaration of a pandemic worldwide underlines that. But it's a challenge that's taking place in the community. We currently have one case and one only in acute care. Obviously, one individual passed away. We have 2 residents of the Lynn Valley Care Home amongst those 46 cases. But this is a case in the community. So aside from those cases, the remainder are in isolation at home. And we continue to make significant efforts to deal with that. I note that the 2 new community cases both stem, as Dr. Henry has suggested, from our surveillance of influenza cases in British Columbia. So they were done as we tested for influenza over the last number of weeks now, just like in the case of case 21. We are testing everyone who's tested for influenza for COVID-19, and that's how those were picked up. On a couple of issues, the Lynn Valley Care Center, and there's significant interest in how staffing is going. Staffing continues to be very steady and very good, and the situation has improved. We've added, as we said yesterday, both infection control staff and communication staff to improve communications to the families involved there. Dr. Henry has noted this, and I think this is important as we seek to support each other in this challenge, is that we're upping our controls on long-term care centers. That communication is happening with with major groups representing providers now, the BC Care providers and others from the Ministry of Health, and we'll be working over the next 24 hours to ensure that new levels of controls of visitors and others are put in place at long-term care centers. This reflects the fact, what we know, which is those that are most vulnerable from this are those with underlying medical conditions and those people that are older. We'll be reporting on Friday on the number of tests by the BC Centers for Disease Control that they've processed both at their center and at 4 centers around BC. As you'll note, last Friday we more than doubled the number of tests over the entire previous period, and again we'll have well more than doubled the number of tests from the entire period in this 1 week. I wanted to say with respect to 811, there have been some issues with respect to 811. I want to note that yesterday I said I think we were up to about 3,600 a day. It's now over 4,000 calls a day, and we are adding new resources to 811 in order to help address those questions, which is one of the main ways that people can get in touch with the healthcare system and get advice. We're asking everyone, of course, who needs support, especially with respiratory conditions, to contact us through 811 or through their primary care provider. And it's important that when they come in to be tested, the healthcare workers are protected, and they are protected, and the public is protected from transmission. And finally, I want to say that we are, of course, appreciative of the announcement by the federal government today of new resources. I think that's an important step and demonstrates the work that we've been doing together, Dr. Tam and Dr. Henry at the medical officers level, Minister Haydu and myself at the minister's level, and of course the Prime Minister and Premier Horgan at their level. Note that we have submitted our requests, which are focused on PPEs and swabs, but in terms of getting materials at the moment, and we're obviously building. We have resources for the healthcare system in case of pandemic, but we obviously want to continue to build out those resources and are working with the federal government to do that. And we are very appreciative of their support, and in particular their support for workers in Canada and in British Columbia. So finally, I think what this shows, this continues to be a major issue in our communities, the declaration of a pandemic by the World Health Organization, the fact that we all can be part of this work together of containing and slowing down the virus here in British Columbia. And that means, and we've said this before, staying home from work when you're sick, staying home from school when you're sick, and there's some things, especially on the work side, that the federal government has done today that assist with the economic challenges of that. Staying away from long-term care when you're sick, which is absolutely critical. Staying away from visiting people in hospital when you're sick is very important, and engaging in social distancing. Today, the Premier, Dr. Henry, and myself met by a teleconference with 128 faith leaders and reiterated those things, and we were impressed by the efforts being made around British Columbia by faith leaders in communities, that they're listening to the messages, particularly those delivered by public health officials in their practices, and showing great leadership in their communities. And with that, we're happy to take questions.
Okay, we'll start with Richard, Justine, and Keith.
What is your recommendation, Dr. Henry, around universities? So we've heard some concerns from students at UBC about attending classes and wanting the university to push towards online courses. We've heard similar concerns at SFU. Is there a blanket recommendation about whether universities should start moving now to banning classes on campus and moving online?
Yeah, so that is something that we've been dealing with, and we've been watching. Certainly in the United States, a number of universities have gone that way, and some of them have taken very extreme measures, like sending everybody home, essentially. So there's no blanket statement right now. I have been talking to universities and other schools, secondary schools, about the importance of allowing people the space that they need and taking those community distancing measures. So I think virtual classes are very much an option that people should be considering, but we'll be having more detailed discussions over the coming days around those issues.
And on sporting events, so we've now seen, the NCAA basketball tournament will be played without crowds. We've seen measures in Seattle and in California and other places. Is it inevitable now that we will see this in British Columbia, that you will recommend sports venues, sports teams play in front of no crowds, and how close are we to that recommendation?
And I think I said this before, right now, nothing is inevitable. The things that we do now can make a difference in our communities. And we're not in the same situation that they are in many cities in the United States, in particular in Washington State. We know that there's challenges, and we know that Governor Inslee has just banned gatherings of more than 250 people. What we're focusing on is the high-risk areas that we're seeing around the world. So we've been watching in countries that have been able to control this, and that's countries like Korea, where they're now in a better position. Places, things that they've done in China, things they've done in other countries that have made a difference, Singapore, Hong Kong. And really what we're seeing is transmission is in groups where you have a lot of close contact, where droplets can be spread. So often that's when you're in contact with somebody, when you're sharing meals, when you're living in a household, or you're having meetings in a closed area. So sporting events can be quite different from that. And at the moment, we're taking the position that we do a risk assessment of each individual event to understand what's the venue it's in. Can it be less crowded? Can you have people sitting seats apart? Can we make sure that people who are sick are not disadvantaged and able to stay home so they get refunds or whatever? So those are the approach that we're taking right now, and we will continue with that approach. We are obviously very mindful of the community transmission both here and in Washington State and in other neighboring jurisdictions. At the moment, we're still taking the risk assessment approach for some of these events, but that may change.
Justine.
So, as a parent who's watched kids harvest everything off the rail in the schools and then just do the things like, I'm just wondering, what is the thought process around when you decide around schools? You mentioned high schools, but I'm also thinking that elementary things. Kids are not necessarily at high risk, but they're certainly good at spreading things.
And there's still, we still don't know the role that children play in spreading these viruses. And what we've been encouraging schools to do, and what they've been doing across the board, I understand, is having more opportunities for children in schools to wash their hands frequently. And I've been given some really neat stuff from teachers around the province of how they're doing that with young kids in particular, and even when there's only one sink and they all soap up their hands and then wash and do it in a line. And so there's ways that we can use this to help build some confidence and help alleviate some of the anxiety that young people have as well. And we're hearing that with children. So it's a way to say, this is how you can take care of yourself and wash your hands, and this will help. So there's a whole lot of pros and cons to closing schools that we are continuously reevaluating. We know we have March break coming up. we'll be looking at what's happening in our communities, and again, those decisions are ones that we'll be making as time goes on, but at the moment, I do not feel there's a need for us to close schools across the province.
Keith, Lisa, and Victor.
So does WHO's designation of a pandemic fundamentally change anything you're doing today that you weren't doing yesterday or that you might be doing tomorrow?
The answer is no. We've talked about this before. Pandemic or transmission of this virus around the world was something that we considered from day one. And so we've always been, I've been talking about contain, delay, prepare. And the prepare part has always been because as transmission increases in countries around the world, there are things that we cannot control. And we know that we've had importations from any place that this virus has been. So we have been on the idea that we need to prepare for a pandemic regardless, and whether it's a capital P pandemic declared by WHO or the fact that we are vulnerable, as every country is, to importations of cases that can spread. We need to take the measures that we need to take. But I think, as I said before, China bought us time. And we now understand a whole lot more about this virus than we did even 2 weeks, 4 weeks, 6 weeks ago when we first were watching what was happening there. And we can take measures that we know will help do that delay piece, that will help protect our communities, and we know the people that are most at risk. So this is what it changes for me is my hopeful that everybody will recognize that we all need to start thinking about this in a more global way. And we all need to take those community separation actions that we do now and think about the things that we can do to protect the elderly and the seniors in our lives. How do we make it easy for a community dwelling senior person to not have to go out and get groceries in a crowded place? How do we make it easier for, we were talking to people who are leaders in the faith communities, make it okay for people to be able to stay home if they're not feeling well. Support them in doing that. Find ways that we can still care and connect with our community, even if we need to stop some of these gatherings over time. We're not there yet, but we need to start thinking about what we do now will help prepare us and help protect us and protect our own families, because that's where we know most of the transmission is.
And the pandemic plan talks about a phase 2. You hope we never get to phase 2, or when do you think that would kick in?
Yeah, and in retrospect, I would not call it a phase, because to me it's pieces of a puzzle or bits of tools in a toolbox, and we can use some of them now. It's not like we're going to all of a sudden shift. And the phase thing really comes from our thinking around pandemic influenza and how influenza moves through a community so rapidly that we can't do some of the things that we're doing now, which is the public health follow-up and the breaking of those chains of transmission. And we have to focus really on mitigation and pushing and trying to control things until we have vaccine. So we're in a different situation. So that phase terminology doesn't really apply to this virus. It doesn't apply to what we know now, which is that we need to continue doing all of our community-based public health on-the-ground work, even if we start to get more community spread. But it also means that the things that we can do right now and as a community to support each other and to prevent transmission is going to make a big difference in us being able to delay that, to minimize the surge that might come.
And remember, right now, as we said, we have one case in acute care, and it was, the cases that have gone home from acute care are great moments for the healthcare workers, for the doctors, for the nurses involved, and of course for the people and their families involved, because it shows that care can work and people can recover. Even in one of the cases today, someone in their 90s. Last week, the case at Vancouver General Hospital, where someone moved from being in critical condition to being in a position to be discharged. But the fact that there's one case now doesn't mean that we're not preparing the acute care system for a more serious situation later. What we're doing now, all of that work is designed to delay that and allow us to be prepared. And every acute care hospital right now is preparing. We may not be using those resources for COVID-19 right now. There may only be one person in acute care right now, but you bet we're getting prepared.
Lisa.
You spoke about the global aspect of this, and and I've asked this before, we'll ask again, heading into spring break, and I mean, some of us have gotten notes from our companies saying that if we come back from the States, we'll have to be in quarantine for 14 days and not come to work. So there's some conflicting messages from our corporations and from what we see on the Government of Canada website, and people are wondering, how do you weigh those varying pieces of information when you have trips to Disneyland and other places planned?
And that is a challenge. And right now, we need to think about it as a personal risk assessment. And if you are older, if you're somebody who has underlying illnesses, you would, in my opinion, you should seriously consider travel internationally. You should seriously consider attending events where there might be a possibility of transmission. Those are things that people need to make choices for themselves, being aware that the Government of Canada website does have health advisories, and some of them they're quite broad right now. Nobody should be going on a cruise, in my opinion, right now. But if you are not in those risk groups and you feel that you're willing to take those risks of potentially being caught up in one of the quarantines that comes on quite suddenly in areas around the world that we know about, those are personal decisions that you have to make.
Binder.
Just with regards to social distance, wedding season is about to come up, or is here, and those are events where people eat together, there's close contact. What advice would you give to those who are planning a wedding either this spring or the summer?
Yeah, these are some of the questions that we talked about with some of the faith leaders today. Weddings, but also death rituals, end-of-life rituals that are also very important for families and celebrate. And many of them also involve people coming together, hugging, kissing, sharing food. We know right now that those are situations where potentially, if somebody has this virus, it can be spread to others. So this isn't forever. This is for now. We're asking people to take measures that make it easy for somebody who's ill not to come, and make sure that they can participate in other ways, that we stay connected, particularly to elderly people. We consider whether the event, if it's a community, if there's people that have been put in quarantine or asked to isolate, there's people who've traveled internationally from areas where we know this is circulating as well. Those are risky events right now. So those are the considerations that people have. Can you increase your spacing? Have people sit every second seat? Forego some of the usual gestures that we do, and it's really challenging because we're used to hugging, we're used to touching. Right now we need to keep our hands to ourselves, keep our germs to ourselves, make it okay within our family groups and within our religious and social groups that we do it from a distance right now, and we look people in the eyes, we smile in the same way that we have before, but be very aware that there are groups right now in the community that are isolating themselves because there have been people who have had this disease that have gone out without realizing it and may have exposed other people. So those events for the next coming weeks, hopefully not too many weeks, but right now, we're asking people to take these social distancing measures to protect our families, because those are the people who are most at risk from this.
Shannon, Cindy, and Mike.
Dr. Henry, can you walk us through what's going on at the Lynn Valley Care Center right now? We know healthcare workers often move between facilities. Is that still happening? And can you talk a bit about the personal protective gear and measures that are in place to ensure that healthcare workers, hopefully aren't transmitting the disease to either the people who are living in these facilities or their families?
And this is, if you're really interested, we do have our respiratory outbreak protocol in long-term care facilities that's available on the BC CDC website. So it's based on that. It's a little bit enhanced because there's so many things that we don't know about this virus and people want to take extra measures. So we do have support from Vancouver Coastal Health. Both the MHOs and public health nurses have been out doing the investigation, and so that is monitoring every single person. making sure that we know who the residents, who of the staff have been ill or start to become ill, giving them advice about how they need to isolate, both so they're not isolating at home and all of the healthcare workers, because then we have nobody to look after them. So there's provisions put in place for them to be wearing masks. And that is to keep my droplets in if I'm a healthcare worker and I have had exposures within that facility, to make sure that I'm keeping my droplets in if I start to become ill on the job. So yes, that is there. Vancouver Coastal, there's an infection control practitioner who's been on site every day to support people in doing that. There's things like visitors are screened, so only visitors who are not sick are allowed in, and they're in smaller numbers. They visit only their family member. I was just trying to think of some of the other things we put in place. The investigation is ongoing. Oh yes, really, really important, because we know people do work at many different facilities. So they are only, they're cohorted, if you will. So the care that's being provided, all of the healthcare workers can only work at that facility right now, and they're not allowed to work at other facilities, and there's a way that we have to be able to know where people are working, and so that's all part of the protocol that we do. And Vancouver Coastal Health, the public health people, have been investigating every single facility where anybody in Lynn Valley worked during the period of time where we think there was exposures, and making sure that there's not outbreaks going on in those places as well. So there's a lot of work going on right now. And you know, the other part of it that's so important is making sure the residents get what they need every day, that they still feel cared for, and that they are connected with their family. And they've put in finally a hotline that's to be able to talk to the families on a regular basis and make sure they get the information they need, because that's so important in supporting the whole community around Lynn Valley.
Any additional concerns or procedures in place around like first responders and paramedics who, you know, deal with people every day who are sick or injured, but might have concerns about, you know, now that this pandemic is also in the mix?
Yeah, so paramedics are part of our whole health system response. We call it pre-hospital care, and we definitely have been putting in place recommendations, and they're part of our infection control groups. They're part of our emergency response structure. The paramedics are all part of Provincial Health Services Authority right now, but they're medical directors involved with our emergency response. And I will say that the personal protective equipment that paramedics wear is slightly different from what we see in most emergency departments for most things and most long-term care homes. So the standard that they use in the community is to wear gloves and eye protection and N95 respirators for all things. And that's because they have very little control about environments they're going into. They don't know very much about the people that they're picking up, and they may have, this has been in place for a long time, so it's because they can come into contact with substances, with other things that can cause ill effects, as well as infectious cases of whatever in the scenarios that we're working in. So yes, they're very much a part of our response.
One last thing. It sounds like 2 premiers have canceled going to tomorrow's premiers meeting. There's another one who's considering it. Any advice from or thoughts from either of you on whether, you know, having this meeting is really important right now, or it's more important to be taking precautions?
Well, I'll let Minister Dix answer some of that. You know, I think I understand that some of the reasons why some people are not going is because of a potential exposure at a large meeting that was held in Toronto recently, and some people had attended that, so they've been advised to take precautions. So that makes perfect sense to me. That's one of the things that we know about large gatherings right now, where there's a time of uncertainty. I think it is an important meeting for a variety of reasons, and this is one of them.
Absolutely it is, and I think our advice to Premier Horgan would be to do all the things that people need to do when they travel to be safe, and he's obviously assessing that situation with his colleagues now, and so certainly he'll be responding to that as well.
No handshakes, and don't go if you're not feeling well.
That's right.
That's certainly what I've said to him.
Cindy, Mike, and Adrian.
Hi. What more can you tell me about the Victoria case? Is that related to the presumptive case that GNS spoke about and the reason why they closed their school? Is there any relation?
Not that I'm aware of. This is a man in his 60s who was traveling in Egypt. Congregants are looking to their leaders to help them through this, and they need to find ways to make space within their communities, to allow for people to stay at home, to look at having virtual services, to look at having maybe some people come for one service and some people come from another, so you can maintain distance within the facility that you have. I think there are many, many options that people can look at, and one of the things we heard was how to stay calm and how to stay connected, because we know seniors in particular, being isolated, not being part of a group, can be very, very socially hard on older people, and we need to find ways to support them to keep them safe. And so whether that means sharing iPhones and having FaceTime, whether it means organizing some of your groups to do calls to seniors on a regular basis, these are the things that they need to think about, what will work for their community to keep everybody safe. And I think that's one of the things that I heard from the faith leaders was they want their buildings and their meetings and their places of worship to be safe for everybody. And so they need to take some measures right now to make sure during this time that they're able to support everybody in doing that.
I think it's for all of us too. It's a matter of ensuring that social distancing doesn't become social isolation. And we heard some excellent ideas from faith leaders today about how they're doing it, and they heard each other speak to it on the call. And I think, we need to protect one another, and that's why social distancing is important. We need to take extra measures. Faith communities have to take extra measures. The whole community does, to ensure that we reach out to people through other means. And we have some of those on social media, some of those, of course, through old-fashioned telephone and others, to keep people connected in a difficult time. As Dr. Henry has said, this may not be a long time, but it's what we have to do now.
So one other thing that I was quite heartened by was offers from some of the faith communities about how can they support their community should we have a large number of people who need to be in isolation. Should we have an event like that? Can they deliver meals? Can they pick up prescriptions for people? So that's the type of thinking that we need to do now as a community to be able to support each other if it's needed.
In Vancouver, some of them say they want more definitive answers on whether it's time to cancel gatherings. Is there a threshold when you might start recommending that?
Yeah, these are questions that I don't have answers to right now. The threshold, it is a question that we're talking about. I've said it as well, in public health, it's a team sport. We're never making these decisions just ourselves. There's a lot of us that are thinking about this. We're thinking about, what's the pros, what's the downside, the social isolation, the concerning things that, people need to have interactions with people. What are the things that we can do to make it safe to still allow people to have those important interactions? And when do we reach that point? And in Washington State, they've reached that point where they think it's important. And I think a lot of it has to do with not knowing where the transmission is in their community. Right now, we have a small number of cases that we have not yet connected, but we're working very carefully on that. So in most of BC, we have very few cases, and we have very low risk. So it's an ongoing thing, and I can't categorically say if we have 10 people, we'll do this. It really is a matter of judging it as it comes, and we have this, what we call a risk assessment, but it's looking at all the different factors. So it may be different in a different community. But we are continuing to talk about that, and I'm continuing to get advice and guidance from people who are much wiser than I am about what I should be looking at.
Okay, a couple more questions from the room. We'll go to Adrian, Richard, and Keith, and then we'll go to the phone lines.
Monsieur le ministre, ça a été abordé, mais à quel moment est-ce qu'il sera décidé qu'il faut interdire certains rassemblements, ou du moins fortement déconseiller certains rassemblements?
Aujourd'hui, on a annoncé 7 nouveaux cas de COVID-19 pour un total de 46 cas en Colombie-Britannique. Il y a un cas, seulement un cas maintenant, qui est dans un hôpital, mais il y a bien entendu, qui est dans un hôpital, mais il y a bien entendu beaucoup de risques et beaucoup de préoccupations de notre part de ce qui se passe ici en Colombie-Britannique. On a fait le double cette semaine de tous les tests qu'on a fait auparavant, et je pense qu'on va continuer avec détermination de poursuivre notre but de limiter le virus, et puis aussi au moins alentir le virus, qui est important. Donc, on donne ces idées, et les registres de santé donnent des avis sur des réunions régulièrement maintenant. Il faut juger sur chaque événement quels sont les risques, et c'est ce que nous sommes en train de faire. Mais il est devenu le moment, ce matin, à l'État de Washington, de prendre l'action que le gouverneur Inslee a pris à Washington, et nous sommes prêts à faire cela, mais il faut quand même suivre la science, et ce que nous faisons chaque fois, en chaque décision menée par des spécialistes comme le Dr Henry, et on va continuer à faire cela.
Religieux disent que c'est difficile d'empêcher le rapprochement, le contact rapproché.
Mais il y a quand même des options, n'est-ce pas? C'est pas tout à fait clair. Il faut que et on en a parlé aujourd'hui, et dans plusieurs cas, on a trouvé des moyens. De toute façon, c'est une manière c'est une manière de participer ensemble d'aujourd'hui. Pas pour toujours, mais pour aujourd'hui. Il faut changer ce que nous faisons dans plusieurs domaines. Et ça, c'est un des domaines où il faut considérer changer ce qu'on fait. Et c'est possible de le faire, on l'avoue, dans la grande majorité des cas. Et finalement, il faut tout le monde dire que ce n'est pas nécessaire d'aller où que ce soit, une institution religieuse que ce soit, maintenant. Il faut laisser l'opportunité d'être absent, soit parce qu'on est vulnérable, soit parce qu'on est malade. Il faut dire que ce n'est pas nécessaire en ce moment pour être là chaque dimanche ou chaque vendredi ou quoi que ce soit. Et je pense que ça, c'est important maintenant. Et je pense que toutes les religions, quelle que soit la religion, en fait, que tout le monde peut donner la permission d'être absent pour les raisons de la communauté.
Richard.
Has Egypt become a growing concern, and is there a recommendation for people not to travel there?
Yeah, so Egypt is clearly something we've been watching, both, and I think I mentioned this yesterday, that we now have 3 people who were on a tour in Egypt, and there are people in Ontario who are also on a tour in Egypt, and I can't remember one other, but Quebec as well, and we're hearing that from around the world, that Egypt is now a source of exported cases, mostly tourists. Many of them were also on cruises on the Nile as part of their tours, so obviously that's a concern. I know we have reported these cases to our federal colleagues, and they are working with the WHO, but I think travel to Egypt right now is very risky, particularly if you're in a tour group, particularly if you're going on a cruise.
So back to the meeting with the faith leaders. You know, we're getting into high holiday season, Easter, Passover, Pesach, many events. Like, is there a thought about recommendations around those family and community gatherings?
And we started talking about that today. We will know more as the weeks progress, but I encourage them to think about ways of having celebrations without having to have everybody together, or at the very least, making sure that it's okay for somebody not to come to Mass for Easter Sunday if they're not feeling well, and to support them to be able to do that in their community at home. And same for other major events that are coming.
And you'll see that over the next few weeks, and clearly in the case of some extraordinary and major events in Vancouver and Surrey and other communities, we'll be working with faith communities on these questions in the coming weeks. In some cases we have a little bit of time, For example, I think the Saki is celebrated April 11th and Burnaby 18th, and Vancouver 25th in Surrey. And in other cases, we'll have an opportunity to work with faith communities, and obviously we'll be briefing here every day and bringing updates as well.
Keith.
Answer this one. I kind of duck out for a minute to Shannon's question, but other than Lynn Valley Care Home, have any long-term care homes received a directive from the ministry or from your office?
No, we have not sent out directives. All of the long-term care homes in the Lower Mainland have been contacted either by Fraser Health or by Vancouver Coastal, and particularly, Vancouver Coastal when they were doing the assessments around Lynn Valley, and I believe Fraser Health sent out some messaging today. But we have met, and I've met with the leaders from both the long-term care and assisted living facilities about this prior to identification of the outbreak at Lynn Valley, when we really started to understand about the risk to elderly people. So this is a message they have heard. We have been in contact, and there's now a stakeholders working group that the ministry is leading. One of the ADMs that the ministry is leading with these groups, so that we know what their concerns and needs are, and we can work with them on it. And they will be getting more detailed information of what we mean by enhancing protections.
Just walk us again briefly through your recommendations when it comes to visiting care homes and to the staff there.
Yeah, so visiting care homes right now is something that we want people to be very conscious of, because we don't want any more outbreaks in those settings. So if you have a family member who's in a care home, stay away if you're feeling ill. Make sure your family doesn't come in if you're feeling ill. Find other ways to connect with your loved one. So it's screening at the entrance to it, reducing the numbers of people that are coming in and out of care homes, because we know more people there, the more chance somebody's going to have a respiratory illness. Spending time with your loved one only, and not spending a lot of time with others, and mixing and mingling in the care home. And for the people who are working there, it's really important to take as soon as you start your shift, to go through and make sure that you're feeling okay, and that you know what to do should you be not feeling well, but also should you develop symptoms during your shift. So those are the things that we'll be enhancing and reinforcing with our community.
Okay, we're going to go to the phone lines. We have Shannon Patterson on the line. Go ahead.
New school closures.
I'm sorry, we missed a bit.
Hi there. We have 3 new school closures today in Metro Vancouver, 2 Catholic schools in Vancouver, where one of them had a parent who apparently tested positive. There was also one in Surrey, an elementary school, where parents were told that they had a communication that someone had tested positive, but, quote, I want to say we have been unable to confirm this with health authorities. So, first of all, can you confirm that those school closures are linked to positive cases, likely the ones we heard yesterday, because the age was right? And what would you say to parents who are quite upset that they're not getting any details about who these parents are, what grade, what classroom their kids are in, and they're really worried for their kids? We heard from a lot of them today.
Yeah, so what I can tell you is that schools have made decisions to close based on their own reasons. There has been no school that has been closed based on public health advice. And public health advice is based on the risk in a center, in a school, and so the public health advice would be, if we had concerns that there was exposures in the school setting that had people at risk, whether it was staff or students or both, we would take certain measures, and some of those might be to close the school, depending on how extensive that risk was. There have been no schools closed in BC because of public health advice at this point.
Okay. Ima Dagahi, go ahead.
Okay, this question is for Dr. Henry. Spring break is approaching. There are going to be thousands of kids home from school. And I guess on behalf of parents, I just wanted to ask if there is anything they need to do differently, I guess with regards to events they have planned for their kids. For example, I had been speaking to some day camps who say they've started to see parents call and cancel. I mean, is that really necessary at this point?
Yeah, so the same message that we're talking about to everybody here. Day camps need to put in place measures to ensure that kids have opportunities to clean their hands regularly, that they identify quickly what to do if a child becomes ill while at the day camp, and that parents have the leeway and the ability to keep their children out of the camp if they're feeling at all unwell. So those are the measures that we need in place in our communities right now. And those are the things that we're recommending at this point.
All right, April Lawrence.
Oh, hi there, Dr. Henry. Just first a clarification about the case in Island Health. Did you or can you specify whether that case is on the North, Central, or South Island?
No, so I didn't, and we, as you know, our practice is to provide the health authority that the person resides in. So this is a male in his 60s who resides in the Island Health Authority.
Great. Okay, next we have Andrea Wu, Globe and Mail.
Oh, hi. I was wondering if there were any updates or working theories yet on how the virus was introduced to the Lynn Valley Care Center.
Yeah, that is, one of the things that we get really excited about in terms of being able to do the detective work in public health. There's been a number of theories that are being chased down. It takes time sometimes to connect those dots. So we do not yet have a theory that we can share, but there are a number that are being followed up right now.
Tyler Olson, Abbotsford News.
Hi. So Fraser Health says it has just 8 ICU beds that are vacant as of Monday. I know Dr. Henry said it's not inevitable that the healthcare system is overwhelmed, but I'm wondering how concerned you are that the hospitals can find the capacity to care for patients, even if we don't see an outbreak on the scale of Italy or other countries. And then kind of part of that, if part of the response involves moving elderly ALC patients into the community, where exactly would they end up going?
Well, we have, as you know, this time of year in particular, in British Columbia, we're at 100% capacity as you expect. It's ordinary flu season. And so what we'll be doing is taking action, yes, to hopefully be able to see patients go home who don't need to be in the hospital and providing supports there. Should there be places in long-term care, we'll be working to do that as well, and there'll be some opportunities to do that. And every hospital and every health authority is working on plans to do that as well. Should it be required, we have other options, including slowing down scheduled surgeries. They're sometimes called elective surgeries, but they're rarely elective. They're just scheduled surgeries. And so there are options that we can do to create space in the hospital to serve patients and serve people who might be affected by COVID-19 and would need care in the hospital. As noted, to date, currently we have one, and we've had some people go in and come out of acute care, but we are preparing for that. That's a key part of the plan we laid out in detail last Friday, and we're certainly prepared for those circumstances should they happen. But look, this is a challenging time of year, and this is a challenge for everybody, and it's why we're acting so aggressively and have been not just this week, but the last 7 weeks. To contain the virus in British Columbia, to push it back and to push it as close to the end of flu season as we can, and to contain it.
I just will say that this is something that we can do if we need to. And for those who were around in 2009 for the H1N1 pandemic, we had a lot of people, young people, who needed ventilatory care. And it would have overwhelmed our capacity, our ICU capacity. But hospitals developed plans around the province because it wasn't affecting every ICU at the same time. And I often tell the story that if we if the Olympics had been planned for October, November of 2009, we would have had to postpone or cancel them because our ICUs were complete. They were full with young people on long-term ventilatory support. when normally people are on are intubated for only a couple of days. So we have plans for doing that. We have plans for, as we call it, decanting, but moving people. And we have to understand that we can move people temporarily to other places. So it's not like a full-time placement in a care home for somebody. So there's provisions that we can do in our system to push people out of hospital who don't need to be in the acute care bed for that period of time. And then you can take over other parts of the hospital. For example, if you're slowing down some of the scheduled surgeries, you can have post-anesthetic recovery where you have nurses who are trained in managing people who are intubated, etc. So there's lots of ways that we can do this in a crisis if we have to.
Okay, Dan Brandt, CBC.
Dr. Henry, can you specify when it comes to, because you've recommended that people do not go on cruises. A lot of people travel on BC ferries. Do you consider BC ferries similar or like cruise ships, and do people need to take any extra precautions on ferries?
No, I don't think they're the same as cruise ships, because you're not, for the most part, sleeping on them. Some of them you are. What we do need to do on ferries is the same measures that we do in other areas where we have to be in communal settings with people. So increasing frequency of cleaning, and that's something that we want to do in all of our transportation systems. Having hand hygiene with you so that you can clean your hands regularly, keeping your distance, covering your cough, and trying not to travel if possible if you're sick.
Jane said from North Shore News.
Hi, Dr. Henry. It's Jane Side with the North Shore News. I have been hearing from some people who have been visiting family members at the Lynn Valley Care Center saying they're going in, they're not seeing healthcare workers wearing masks, wearing gloves, and they're concerned that they should be, and they're concerned that maybe not enough cleaning is happening there because there aren't enough staff to do that at the Lynn Valley Care Center. What can you tell me about that situation?
Yeah, I can tell you, and I know there's sometimes some challenges because there are several buildings in that area, and people may not be reflecting what's happening in the area where the outbreak has been detected and ongoing. But Vancouver Coastal has been in there with staff, including infection prevention and control specialists, to make sure that people know what to do and that are able to do what they need to do. We know that there were some challenges over the weekend in helping people get to that point, but I'm confident, and I hear from my colleagues that today things are underway and that it's working well.
Camille Baines.
Hi, Dr. Henry. I'm wondering, the workers at the Lynn Valley Care Center, the latest two, are they also care aides? And when you have a private facility like this with different contractors bringing in care aides, housekeeping staff, food services staff, what kinds of challenges are presented when you're trying to figure out the source of this, how this whole thing got started there?
Right. So just to be clear, all of the people that we've identified are healthcare workers. I've not said whether they're care aides or LPNs or cleaners or housekeepers. So we're trying to keep it at that level. Having said that, yes, it is a challenge, but Vancouver Coastal has made some decisions as an organization to support the people, all of the workers, regardless, to be able to manage through this crisis. So they're all considered part of the team that is working at that Lynn Valley Care Center right now. The challenges that we have are around contracted services, understanding where people who are working in Lynn Valley, what other places they're working at, and that means you have to go through different organizations to get that information. And it's taken a lot of time and effort to make sure that we can identify every place that every worker on the outbreak part of the facility has been anywhere else. But it does add to the challenge, and it adds to some of the challenges about why people need to work in many places because of the wage that we give to people who are in some of these work environments.
And I think this has been an issue in long-term care for some time, and there'll be other occasions to talk about it, but clearly this is a consequence of things that have taken place over a significant period of time. And right now what we're doing, because we're in these circumstances, is supporting the workers at the Lynn Valley Care Centre and at other care centres across British Columbia.
Okay, Srishti Ganjap, go ahead.
Hi. Yes, I'm just wondering, we've talked a lot about, big gatherings and risk assessment from the Public Health Agency of Canada and things like that. I'm just wondering what would happen in the circumstance that an event organizer looks down that list of risk assessments, they check off the boxes that they check off and decide to go ahead with the event.
So this isn't something that people do in isolation. We do it in partnership with the health authority. So one of the key people that they have to get permissions from and all of those things for holding events is the health authority. It's often done by what we call environmental health officers here in BC. So there is a process in each of the health authorities to work with the organizers to do that checklist, and so that health has some influence on whether the risk is acceptable or not acceptable in that community.
Okay, Amanda Follett Hosgood, go ahead.
Hi there. I'm calling from Smithers, and I'm curious to know if there's been any consideration given to remote communities in the north, whether there are unique challenges or whether there are opportunities to get ahead of it up here.
Yeah, absolutely. We've been talking quite a bit, both for remote and isolated communities, but also for First Nations and other Indigenous communities that are often a combination of remote and First Nations. So we do have strong connections with our colleagues from the First Nations Health Authority, and we've been adding pieces that are unique to remote communities. It's been part of our influenza pandemic planning, and some of those principles are similar. The risk may be smaller in that you don't have as many people traveling, and right now it is travel that is still related, whether it's travel from the Lower Mainland or Washington or around. But the impacts can be potentially so much greater if you do have cases or an outbreak in a smaller community. So we are putting in contingency plans. We're putting in, and we have advice around how to prevent things on a community level, what sort of considerations need to happen for, one of the other seasons that's coming up is potlatch season, and how do we make sure we're protecting people in the communities for those events as well.
David Lundgren.
Yeah, thank you. What special provisions, if any, are you taking to protect the homeless and staff working in shelters?
Again, those are ongoing discussions. We have the basis for some of the things that we need to have in place, connecting with community groups, and there's some people at the British Columbia, the BC Centre for Disease Control, who work with our with providers in communities to make sure we have contingency plans. One, that they get information that they need, that they're able to know how to detect this if it's possible, that we're aware of where people who are either street involved or homeless or in shelters or in our assisted supportive housing. How do we connect with them and make sure they know what to do, and that they start having plans for what to do? So that's something that is ongoing as well. And the new all-of-government approach allows us to work more closely with housing and BC Housing and others around those areas.
And we know when we talk about people who are vulnerable in BC, it's people, of course, who are elderly, and we have a lot of focus of that, particularly with our actions with respect to care centers today and to date. But obviously people who are vulnerable include people with chronic diseases, people with mental health and addictions issues, people who are homeless, and so on. And so the cross-government plan tries to address all of those questions, but they're real challenges, because if you look at the work done, the examination of 70,000 cases in China, you know that if you have an existing condition, that your outcomes with COVID-19 are worse, and so we're focused on all of those communities.
Okay, last questions on the phone is from April Lawrence.
Hi. Just one more question about the case announced in Island Health, a man that recently returned from Egypt. Can you tell me whether he was showing symptoms and self-isolated immediately upon his return, or whether he was in the community for some time before exhibiting symptoms?
I don't have all the details. My understanding from talking with Island Health is that there are a small number of close contacts, but they're still in the process of identifying where he had been since returning and how he got from point A to point B.
Okay, coming back to the room. Any other questions? Cindy?
Would you mind walking through one more time, especially if someone doesn't have a family doctor, if they're concerned that they think they have the virus, what are the steps that they go through to getting help or seeking direction? And secondly, if you mind, I was on the mistaken, perhaps, impression that testing took 24 hours, but we have presumptive cases, and I know that in the GNS case they said the man was getting tested, it was Monday, it's Wednesday, and they still don't have they say they don't have a full test or a result. So can you go over that for me, please?
So there's a couple of things. If people are sick, the first thing they need to do is stay away from others, stay home, look after themselves. If there is a concern that you might have been exposed to this virus or that you're suffering from this virus, then step number one is to either call your healthcare provider if you have one, or to call 811, and 811 can help guide you. And we've been talking about bolstering the services at 811 to meet that need. Not everybody who has a cold or a flu or symptoms of cough or shortness of breath has been exposed to this virus or needs to be tested for this virus. So the first step is to call ahead. And if your provider believes that you need to be tested for influenza or for anything else, then they will make arrangements for you to be assessed safely and if tested if needed and cared for if needed. So there's advice that we can give to people about how to self-isolate, etc. I'm sorry, I lost your last question.
In terms of diagnosis and testing, how long does it take?
The test in the lab, they're now running it 2 or 3 times a day, and we know that the lab here in Island Health has recently been one of the test sites that can now run the test. So the test itself, it takes you have to go into a provider and they do what's called a nasopharyngeal swab. They stick a little Q-tip, or sort of long Q-tip in the back of your throat and try and get some of the cells that might have virus in it. And then it goes to the laboratory. So now that there's the ability to do it here in Island Health, they're still validating the testing that they're doing here. So it's called presumptive positive when it's positive here, and it's confirmed at the BC CDC lab. But in general, by the time the swab gets into the lab, it's within 24 hours that you have a result.
Here, so that if you're in Island Health case, you would get swabbed, you might get a presumptive reading or one.
Yeah, so up until a week ago, the test got sent to the BC CDC lab. And as I said, once it gets to the lab, it's within 24 hours that the test result is gone. But sometimes it was a delay to get to the lab. Now that the lab here in Island Health, and there's one in Kelowna General and St. Paul's and VGH and the Lower Mainland are able to do it as well. So the Island Health test will come back first, and then they send it to BC CDC to confirm it. But so the test that we announced today is a presumptive positive because it was done in Island Health. It will be confirmed, and I have no doubt that they're using the same methodology, that they'll confirm it at BC CDC.
And so there was no delays. There's no delay in announcing this today, for example.
It take how many days until you get the full result or the positive result from test?
The test is positive today, right? So it's just confirming that the test was done properly by the BC CDC. So all the measures that we're taking for the individual who's positive started when he was suspected of having this and was having taken the test. So he was in isolation. He remains in isolation at home.
Okay, we have Tanya Fletcher on the phone. We'll wrap things up.
Hi, Minister. I know you guys have kind of touched on this already, but regarding all of the looking in Washington State, the school cancellations and the sporting events, could you just explicitly explain to people who is in charge of making those decisions here in BC, and maybe, for example, give the difference between something like a public school closure versus a university versus, private sporting events, like who would decide to shut down a Canucks game, and the advice that would be given.
You go ahead. We'll do that after you.
Two levels in that. So if I felt that there was that it was an action that needed to be taken to reduce the transmission, to protect the public, and that we were in that situation, I can, under the Public Health Act, order events to be cancelled. And that's some of the provisions that they've done under their state of emergency in Washington State. Right now, I don't believe that widespread, quite not very refined method is what we need right now. We provide advice to schools, we provide advice to universities. If I provide advice to close, most of them would, of course, follow that advice. And if I felt there was a compelling need for them to do that, or the MHO in their local area felt there was a compelling need for them to cancel an event or not hold an event, we have the ability to do that voluntarily or to order them to do that. Having said that, if there's events for which we're doing a risk assessment with them and we feel that there's not a risk to the community and that the risks at the event can be mitigated, then it's up to them to decide whether they want to go ahead with that event or not. And as I've mentioned with the schools, we have not provided the advice to any schools so far that they need to close. However, the schools are able to take those decisions themselves to do the measures that they feel are important for their community. So we're kind of in that in-between phase.
Thank you. That's good.
Thank you.
Thank you. Thank you.